So Maliheh Free Clinic provides free health care to those who are 150% of poverty level or below with no insurance. We don't get any federal funding. All of our funding comes through private donations and grants that are written for the clinic, and 95 cents of every dollar that comes into the clinic goes to direct patient care, which we're able to do because we're volunteer run. We have almost 500 volunteers and a small core staff of paid employees. We have everything from doctors, nurses, interpreters, medication assistants, and all kinds of different volunteers that help our patients in any way that we can.
A vast number of people deal with poverty, pain, disease, and illnesses every day that can have detrimental effects on their quality of life. And I think the Maliheh Clinic greatly benefits our community by offering free quality health care for the low-income, underserved population here in Salt Lake. It's also highly rewarding for me and everyone donating their time here to be part of this great organization and be able to give back to the community that has given us so much.
One of the things that I really love about coming here to the Maliheh Free Clinic is that we get to work with pharmacy students. Our dean, Dr. Wayne Samuelson, always is drilling into our heads, never practice medicine without a pharmacist. So this is a great opportunity to get to know the pharmacy students and to get to collaborate with them. So it's really a wonderful thing that we have.
I got involved in the Maliheh Free Clinic during my P2 year. I had the opportunity to volunteer as a student with the University of Utah College of Pharmacy, and it's really instilled in me what it means to have the opportunity to work interprofessionally with other students. I learned so much, and I continue to learn so much from the students at the medical school at the university, as well as the PA school, nurse practitioners. I think it's a great opportunity for all of us to learn from one another and what we can do when we work together to provide great care for our patients in the future.
The dream kind of started here in this clinic a few years ago. I started as a medical interpreter for Spanish and Portuguese, and also as a dermatologist assistant. And Maliheh has definitely been a huge part of me when it comes to pursuing this journey, but definitely how to care for patients and to bring down all those barriers and disparities when it comes to race, religion, and even documentation, because everybody's welcome here. It's just super awesome that in the future perhaps I can get to return home again, but now as a certified PA and a provider to my community.
For Maliheh Free Clinic, I think our patients here and our students are really both benefiting. One of the things that is really important about this clinic is that we're not just providing care today, but we're ensuring that these patients have care, ongoing care here at the clinic. And the students are really getting the experience of not only working with patients, but working with students from other disciplines. So the med students, the PA students, the nurse practitioner students, and the pharmacy students all really coming together and providing great care for patients. And as a faculty member, I also get to learn from all of my colleagues in those professions as well, which I think is really helpful as we pursue other scholarship and teaching pursuits back at the University of Utah. But when we have students that can come to Maliheh Free Clinic, they really can see what we do as ambulatory care pharmacists. So working in teams, ensuring that the medications are appropriate for the patient, and making sure that patients understand why they're taking their medications. So this is a really important thing that we can begin teaching our students.
So your support of the clinic allows us to be able to see more patients and to be able to give them the services that they need. We have new patients coming in every day that don't have any other access to health care. So everything you guys can do and bring in for the Maliheh Free Clinic, the more services we can provide for those who really need it.